In this video, we're going to discuss about endometriosis symptoms and signs and why they take so long to get diagnosed. Endometriosis is a chronic and sometimes debilitating condition which affects about 1 in every 10 women. It has impacts on the physical, mental, and social lives of affected people. It takes an average of 7.5 years from onset of symptoms to diagnosis. What is responsible for this delay in getting a diagnosis? Come with me in this video as we delve into the puzzling world of endometriosis. In the United Kingdom, an all-party parliamentary group reviewed the care of women with endometriosis in October 2020. They found that 58% of people from a group of 10,000 who took part visited their family practitioner more than 10 times. Yes, you heard that right. Before being diagnosed with endometriosis. They have subsequently made recommendations to improve the time it takes to get diagnosed, as well as improve other aspects of the care of endometriosis patients. Welcome to Shalom Health, a channel where we aim to empower you to lead a better and healthier life. First of all, I will define what endometriosis is, go through the risk factors, causes, and symptoms, both common and less common, and then discuss the reasons why diagnosis takes so long and what can be done about it. Definition: endometriosis is defined as a condition where tissue similar to the lining of the uterus grows outside the uterus, for example, on the ovaries and on the fallopian tubes. General facts: endometriosis is the second most common gynecological condition in women after fibroids. It affects 1 in 10 women. It is, however, underdiagnosed. It takes an average of 7.5 years from the onset of symptoms to get a diagnosis. It can affect women from adolescence to menopausal years, but it is especially common in the 25 to 40-year age groups. The risk factors are early menopause, which is when somebody has a menopause at age 45, late menopause, that is menopause starting after age 53, delayed childbearing, which is when somebody has a first child after the age of 35, family history, ethnicity, being white can increase the risk, vaginal outflow obstruction, autoimmune diseases, and late first sexual encounter, and smoking. Common symptoms of endometriosis: chronic pelvic pain, that is pelvic pain that is lasting more than 6 months. Period-related pelvic pain that affects daily activities and quality of life. Deep pain in the pelvis during or after intercourse. Painful bowel movements during periods. Pain before, during, or after urination when you're on your periods. Infertility. Other common symptoms are diarrhea, particularly during your periods. Constipation, particularly during your period, plus or minus bleeding from the back passage. Nausea during periods. Period problems. The periods may be heavy, prolonged, painful. There may be irregular bleeding or spotting between periods. There may be pain during ovulation. Pain during a pelvic examination could be a symptom of endometriosis. Less common symptoms of endometriosis are depressed mood, fatigue, headache, low back pain, leg pain. Now let's talk about the consequences of endometriosis. If left undiagnosed and untreated for long periods, endometriosis may cause problems with getting pregnant. Long-term pelvic pain may interfere with social and work activities. It may result in the development of large cysts in the pelvis, which can eventually rupture. In rare cases, the endometrial tissue may block the intestines or urinary tract. Right. We're going to talk about guidelines now. As you can see, endometriosis can present with a variety of symptoms which can lead to diagnostic delays. NICE guidance. Here, NICE represents the National Institute of Clinical Excellence in the UK, states that endometriosis should be considered in women or girls presenting with one or more of the following symptoms or signs: chronic pelvic pain, period-related pain, that is dysmenorrhea, affecting daily activities and quality of life, deep pain during or after intercourse, period-related or cyclical gastrointestinal symptoms, in particular painful bowel movements, period-related or cyclical urinary symptoms, in particular blood in the urine or pain passing urine, and lastly, infertility in association with one or more of the above. Importantly, the guidance advises that the possibility of endometriosis should not be excluded if an abdominal or pelvic examination, ultrasound, or MRI are normal. If this is the case and clinical suspicion remains, further assessment and investigation, including referral, should be considered. Now, as promised, we're going to talk about the reasons for delay in diagnosing endometriosis. Now we've discussed the symptoms, we will attempt to answer the question of why it takes so long to get them diagnosed. Firstly, endometriosis is notorious for masquerading as other common conditions. Symptoms like menstrual pain, fatigue, or bloating can easily be mistaken for less severe ailments, leading doctors down alternative diagnostic paths. This misdirection often delays the accurate identification of endometriosis. Secondly, there are societal and cultural factors that influence the perception of pain and symptoms. Most women sadly endure painful periods as a perceived normal, in quotes, part of womanhood. This normalization often leads to underreporting, and thereby it undermines the urgency of seeking medical attention. Any period pain that is enough to cause you to be unable to do your normal daily activities should be discussed with your doctor. Remember, it is essential to listen to your body and trust your instincts. Diagnosing endometriosis depends heavily on the experience and expertise of healthcare professionals. It is important for them to be able to identify the subtle signs and symptoms, and distinguishing them from common variants may require specialist knowledge and sometimes collaboration of multiple medical disciplines. There may be long waits to see these specialists, so we need more training of endometriosis specialists, and family practitioners also need ongoing training to identify and deal with endometriosis symptoms. There needs to be research on finding out better ways to diagnose endometriosis early. Current diagnostic methods like ultrasound do not detect subtle cases of endometriosis. A normal ultrasound result does not rule out the diagnosis of endometriosis. If your symptoms are persisting, please go back to discuss them with your doctor. Amidst these challenges, it's important to keep the conversation alive. By raising awareness about endometriosis and its elusive diagnostic journey, we can empower women to seek appropriate medical care and advocate for themselves. Remember, knowledge is power. So there you have it, the multifaceted reasons why it takes a long time to get diagnosed with endometriosis, from its mimicry of other conditions to societal misconceptions and limited healthcare resources. It's a complex puzzle that begs for a solution. If you suspect endometriosis, don't hesitate to consult a healthcare professional, and remember, you're not alone in this journey. Thanks for watching. There is a link to a pain and symptom diary within the description of this video. This will help you to record your symptoms. It is recommended that you do it for about 2 to 3 months or more. Please check your symptoms with your doctor first before you embark on recording your symptoms in the diary, as some symptoms may represent other gynecological and gastrointestinal disorders and not necessarily endometriosis alone.